Intermenstrual pain usually appears on only one side of the abdomen in the middle of the menstrual cycle, when ovulation is happening or about to happen. It can be very annoying when it becomes repetitive. Many women experience different discomforts during their period, but this is not the only time in the menstrual cycle that can cause discomfort. There is also intermenstrual pain that, as its name implies, is one that appears between menstruation and menstruation. Intermenstrual pain usually appears in the days near ovulation. That is, around day 14 of the cycle. Ovulation is the process by which the egg travels from the ovary to the fallopian tube. This process is accompanied by an inflammation, a hormonal peak and a series of events that can cause discomfort in the belly. It is estimated that almost 20% of women experience this intermenstrual pain. In this article we explain what you should know about it. What is intermenstrual pain? Intermenstrual pain originates in the ovulation process. This event takes place in the middle of the menstrual cycle. Logically, it only occurs in women of childbearing age and who have menstruation. During ovulation, the growth of one of the follicles that contain the ovule inside the ovary occurs. The walls of the ovary are distended and inflamed, and, when the time comes, the follicle breaks. This rupture and release of the ovule is sometimes accompanied by blood and fluid that was inside the follicle. These fluids reach the peritoneum, which is the inner lining of the abdomen. The peritoneum is irritated and causes pain. Therefore, intermenstrual pain does not occur exactly at the time of ovulation, but may occur a little earlier and persist later. In each cycle, ovulation takes place only in one of the two ovaries. In this way, intermenstrual pain appears on only one side of the abdomen. Many women suffer each cycle, although others only experience it on certain occasions. In addition, in each cycle intermenstrual pain can change sides. Until the duration is variable, since it can be momentary or persist for hours. To distinguish intermenstrual pain from other pathologies, it is important that women know their menstrual cycle. The fact that it is a stabbing discomfort on one side of the lower abdomen and that coincides with ovulation is defining for the diagnosis. What can be done in the face of intermenstrual pain? For any pain or discomfort, the ideal is to see a doctor to find out the cause. It is important to explain the characteristics of pain to the doctor, since only with that can intermenstrual pain be diagnosed. Sometimes gynecological examinations and ultrasound exams are performed to rule out other pathologies. To treat intermenstrual pain, there are certain general measures that can help. For example, apply heat to the abdomen or rest when the discomfort appears. The truth is that most women do not require any other treatment. However, there are medications that can help if the pain is too intense. The most recommended is to use nonsteroidal anti-inflammatory drugs (NSAIDs) such as ibuprofen. They contribute significantly to reduce inflammation and pain, and are sold without a prescription. Another alternative is to use oral contraceptives. The mechanism by which they act is avoiding ovulation. In this way, they also eliminate all possible inconvenience that the event can cause. You may be interested, how to mitigate painful ovulation? In conclusion, intermenstrual pain is one of the negative consequences that the menstrual cycle can have. Each woman works in a different way, and only around 20% suffer. In addition, it can have different characteristics and vary each cycle. Therefore, it is important to know and distinguish it from other pathologies. If it becomes too annoying or disabling, it is essential to go to the doctor and try to choose the best solution for each specific case.